We often hear medical billing and coding grouped together, especially in things like training programs where they say it's a medical billing and coding training program, but are they the same or are they different? And if they're different, what are the differences? Well, we're going to be covering exactly that in today's video. Hey there, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical billing and coding career. If you haven't already, highly encourage you to subscribe and hit the notification bell so you can get alerts when I post new episodes. Today's video is sponsored by Preppy, but more on them in a little bit. The healthcare field is really a great place to work. It is advancing very significantly, and there's so many different career opportunities. But when you don't want to get into clinical work or hands-on patient stuff or deal with patients at all, it kind of narrows the scope of jobs that you have available. But one of the first ones people tend to look into is medical billing and coding, especially because medical billing and coding tends to be one of the top work from home jobs. Now, billing and coding are two different tasks. I say they're kind of like two sides to the same coin though. In some organizations, especially if they're smaller, the biller and coder might be the same person. They might be doing both functions. In a lot of organizations, they're two different job titles, two different positions, actually sometimes multiple different types of positions. But a lot of training programs out there, like you'll find at your community college and your tech schools, will prepare you for both. And if you're interested in a career in medical billing and coding, I would highly suggest that you sign up for my free masterclass at medicalcodingmasterclass.com. In this free masterclass, I give you all the information that you need to know before you start a career in medical billing and coding. What certifications to look for, what your job prospects are, salary, day in the life. Like, it's the whole blueprint of how you can go from someone who is not in the healthcare realm at all to someone who's job ready as a medical coder in as little as 6 months, and without going into student loan debt. And then it tells you a little bit about the program that I fully endorse, which is called Preppy, and you can find out everything you need to know at medicalcodingmasterclass.com. I will also link it in the description below. So let's talk about the differences between medical billing and medical coding. So what is medical coding? Medical coding is the review of all of these healthcare reports, notes, labs, services, equipment, diagnoses, and then converting them into uniformed codes. We use it for a variety of purposes, a lot of statistical data. How many patients in a certain area are developing diabetes? How many of them are developing certain complications of their diabetes? Well, the ones that aren't, like what happened, like did they get certain services? We can track all of that with codes. We can also do things like make budgets. If we see the cost for certain conditions and how many people are going to develop these type of conditions over the next so many years and what their healthcare consumption is, and calculate for inflation, we can figure out how much money we need to have in budget for future healthcare expenditures. But of course, the big thing that people think about when we take these medical codes is that they have to go onto a claim form and get billed out to insurance. Or in some case, they might be private pay, so it might be something that the patient is paying for out of pocket. But in either case, we have to take the codes, they go on the claim form, and then the biller is the one who makes sure that they are accurately on the claim form. It's going to the right place to get that check back. It's going to be formatted correctly. It has the right modifiers. There's no, anything that needs to be scrubbed on that claim form before it goes out. Both of them involve a lot of research, but coding involves more reading and analyzing, whereas billing involves more kind of puzzle solving. Billers and coders often work together because, as you can imagine, if something gets billed out and then it's denied and they say, hey, we think maybe this wasn't coded correctly, or there was a coding related issue, that biller might say, hey, coder, can you take a look at this? Although oftentimes when you hear things like, oh, it wasn't coded correctly, that's kind of the insurance's way of saying, well, it wasn't coded the way that would have gotten paid, but that patient necessarily didn't have those conditions that would have gotten it paid. But it's up to the biller to kind of troubleshoot to the best of their ability to make sure that we can get all of that reimbursement for that service that was rendered, and what the next steps might be if they are not receiving payment for that service. Now, both billing and coding are jobs that you can get without any sort of degree, although with medical coding, they do require certain certifications. It's not like legally required, like you can't work in this state unless you've passed this board exam. There's no such thing as a board exam. There's just a certification exam. There are certifications for billing, but it's not something that employers are relying on as heavily as the coding certifications. They really want those coding certifications for coding jobs, and especially through AAPC or a HEMA. Those are your Coke and Pepsi in the medical billing and coding world. There are other ones out there. They're just not as recognized by employers as AAPC and a HEMA. Now, neither of these jobs involve clinical work or you having to speak with patients, although you do have to speak with other individuals within your job. In the coding realm, you might have to talk to other coders or coding supervisors, and you might have to talk to healthcare providers to clarify things on documentation. Maybe there's something that was missing or needs to be further specified in order to capture everything that really happened during that encounter. On the billing side, you'll probably be dealing more with the insurance companies and insurance representatives, although a lot of that work now is done through insurance portals. Some of the jobs you might find in medical billing are titles like medical billing specialist, billing coordinator, patient account representative, medical billing clerk, healthcare billing specialist, insurance billing specialist, accounts receivable specialist, or medical office biller. Some of the job titles in medical coding are things like medical coder, coding specialist, health information technician, medical records coder, clinical coder, coding auditor, medical coding specialist, inpatient coder, outpatient coder, and risk adjustment coder. Sometimes coders have trouble landing that first medical coding job and they wind up starting out somewhere in like billing. So as long as they're in the revenue cycle and they're learning things about how claims are generated and insurance, like it's so beneficial to be more well-rounded in the whole revenue cycle. And sometimes coders find out that they like the billing side so much they just stay in billing. In billing, it's a lot more about fighting for the payment that's deserved and following up and making sure that we are compliantly maximizing our revenue. In medical coding, it's more about converting all of that information into that codified data. However, medical coders do tend to get paid more. In the most recent AAPC salary survey, medical coders were making around $63,000 a year, whereas medical billers were only making about $60,000 a year. And there's a lot more growth opportunity for medical coders. Medical coders do things like get into auditing and compliance and specialty coding, and depending on what sort of specialty they get into, they can make a lot of money. It's not uncommon, for example, for certain inpatient DRG coders to make north of $100,000 a year. Although one thing to consider is that although continuing education is important for both of the fields, billing and coding, medical coders have to get continuing education in order to maintain their credentials. They need to meet certain requirements for CEUs, continuing education units. So there is some added cost to having to belong to that association and then maintain those credentials and get the continuing education credits. So how do you choose? How do you choose if you want to do medical billing or medical coding? Well, the best advice I can give you is to go through a comprehensive training program like Preppy that will prepare you for both. And then while you're going through training, you can see if maybe you have a preference and kind of go from there. But remember that stepping into either of these roles is going to require some dedication and some passion for what you're doing, especially because of certain things like continuing education credits and making sure that you're getting into the right certifying body like AAPC or HEMA. Investing in your education is investing in your future success. So there's a lot of areas for growth and specialization. And it's also important because, you do make a difference, because how much do you love not getting an incorrect bill in the mail, right? If you're ready to take that first step into learning more about this career, medicalcodingmasterclass.com. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.